comfortable? They can see this okay? And again, I'm pretty sure I did this about a year ago, but I like the information, especially this time of year when it's warming up and we want to get busy and feel like, okay, I can take on some of those healthy activities and such once again, as well as food choices. And so this is a good review about where's your health compass? Is it directed true north? Or is it getting swayed a bit by other issues? All right, now, my question is, so ideally, we're going for that optimal health, optimal wellness. Oh, back up. Every choice we make either moves us toward or away from optimal health. If we stood people on a spectrum, a line, plopped you in the middle, is my choice to have that bowl of sugared cereal moving us toward better health or worse? Is that choice to take a walk moving us toward better health or worse? Again. And we're faced with those choices all day long. And those three primary areas are how we eat, how we move, how we think. Again, those are the details come next. So our current model of health, unfortunately, the National Coalition on Healthcare, which is a group of organizations, mostly peer, local, those of us who fall into, these are not healthcare providers. They unfortunately describe our healthcare system as ineffective, excessive administrative costs, inflated prices, all of that. And we kind of know that because there's lots of duplication, there's lots of cost, but unfortunately, it doesn't necessarily mean we have better health. And they expand on this. Time magazine, and this was a few years ago, but indeed, we are living longer, but we are not living healthier. In this small print, it says, despite advances in medicine, Americans are less healthy than we used to be, and the next generation may be even worse off. And I see that in my office. I've been in practice about 25 years now. And my concern is with the 20 and 30-year-olds who are coming in now that really are in less good shape. I mean, they are in poor condition physically, certainly nutritionally, than probably when you were in your 20s and 30s. You came off a home that had lots of home-cooked meals, probably lots of fresh fruits and veggies. You got exercise because you had to, and that's not the case nowadays. So I really worry about, again, these young people going into the work worlds where they just cannot handle certainly physical tasks, and even sitting at a desk for long hours. That's causing a lot of stress to their bodies. We need to keep promoting the idea of being active every day and making good choices. So this is going to tease me. So are we getting our money's worth from our healthcare dollars? Spending on healthcare is the single largest component of overall consumer spending, larger than what we spend on housing or food. Maybe not fuel this year, but housing and food. And that kind of surprised me. And that's because certainly in my household, I'd like to think that's not true, because I'd like to think we're pretty aware of our health and we don't utilize a lot of medical care. We don't have a lot of chronic illness. But I guess I'm not in quite that average household. America spent about $2.6 trillion last year, and that's been true for the last few years, on health care, according to the congressional budget. So $8,300 per person, about 18% of our gross domestic product. If someone gave you $8,300 at the beginning of the year, do you think you'd need that much on your health care? And yet, again, it all ties into, what our companies pay for insurance coverage, what our Medicare and medical assistance, that all builds up to that kind of number. And they're saying by the year 2021, they expect it to be nearing $5 trillion, and about 20% of our gross domestic product is going toward healthcare costs. Something's got to change. Welcome. Oh, come on, you have to come back farther. You're not going to see anything. That's quite all right. So the interesting fact here is that worldwide population, The U.S. is about 4% of that total population, and yet we spend about 50% of total money spent on medical care for 4% of the people in the world. You would think we are absolutely the healthiest nation on earth. Unfortunately, not the case. We spend the most. Where does the World Health Organization rank America's healthcare system? There's a big list. And we come in 37th. Oh. Behind all of these other countries, and some countries that we would consider maybe third world nations almost. Cuba's ahead of us. So again, it just doesn't quite make sense that we struggle with our overall health care in such an industrialized nation that we think we're so far ahead. So really, prevention is the key, and we have to keep promoting that idea that we have to nip things in the bud, catch things early, and most of it is, again, by the choices we make every day. Preventable illnesses make up 75% of the burden of illness. So preventable things such as certainly type 2 diabetes, a lot of heart disease issues, a lot of respiratory issues that become chronic because it wasn't handled well in the first place, and we're not encouraging people and educating people how to manage this better early on. So it, again, progresses rapidly and gets to a point where it's very difficult to reverse that trend. Lifestyle changes create wellness. Symptomatically treating diseases without assessing the patient's lifestyle or offering guidance on how to change is irresponsible and bordering on neglect. So Dr. John Kelly, who was president of the American College of Lifestyle Medicine back a few years ago. And unfortunately, in most medical clinics, these doctors are being pushed to see people so rapidly, they aren't given the time to help those patients understand lifestyle issues that are affecting them. So again, as Terry said, if they are offering you a consult with a nutritionist as part of your health care at no additional cost, absolutely take it. Ask for what other resources are available to me to help me understand my condition and what I can do to help my condition and manage that. So, cause of preventable death. The number one cause of preventable death is suicide from lifestyle choices. And unfortunately, we know those people who are on the road to suicide, who are making very poor lifestyle choices. Don't know if that's going to happen in a few days, a few months, a few years, but we see it every day. And hopefully, we can help prevent friends and family from going down that path. So where is your true north? Are you making good choices that influence your overall health and wellness? So let's start with the definition. Health is the state of optimal physical, mental, and social well-being, and not merely the absence of symptoms or disease. Again, for most of us, when we think, I'm sick, it's because you have some kind of symptom. Something obvious is just not feeling well. But we also know a whole lot of people that are given a clean bill of health and find out that they died of a heart attack a couple days later. So just the absence of symptoms doesn't necessarily mean you are well. Certainly not optimally well. Wellness is an active, lifelong process of becoming aware of choices and making decisions toward a more balanced and fulfilling life. Wellness involves choices about our lives and our priorities that determine our lifestyle. The wellness concept is centered on connections and the idea that the mind, body, spirit, and community are all interrelated and interdependent. We cannot isolate ourselves and be well. We need to, again, tap into all of those resources out there and be aware of health and wellness in all of those parameters. Our knowledge, our attitude, our skill at managing, again, those lifestyle choices. Again, a lot of it starts with the knowledge, being aware of what we're dealing with. Having the right attitude about, okay, this is where I'm at this point. How can I improve on my lot in life? And then building the skills. Again, tapping into those resources to help us understand how to deal with those lifestyle issues, environmental issues, what have you, that are affecting our overall health and wellness. Once again, every choice we make is either beneficial or suicidal. And when you put it to that extreme, and maybe there's people in your life that you have to put it to that extreme. Is this a beneficial choice, or is this sending you down the road to suicide, in a sense? Choices to create habits. We're going to start with starting your day right. Breakfast really is important. You want to start that furnace burning calories from the get-go. Again, it shouldn't be a dozen of those little donut holes and a cup of coffee. No. Break the fast with foods that are easy to digest and those that provide slow, steady nutrition. Again, fruits, juices, high fiber, whole grain cereals, breads, eggs, get some protein in there, nuts, things that, again, are going to initiate that digestive process but also linger for a bit so that energy source stays in your system. I personally use greens drinks quite often. Again, it's a good variety of nutrients in that, easy to take, but in addition to, I'm someone who will eat granola and yogurt, certainly eggs of all sorts, again, a high fiber bread, toast, etc. But again, make those choices to start your day. Hydration, big one. Water should be your beverage of choice through much of the day. Try your best. Again, I'm okay with a lot of teas if you're not, again, adding lots of sugar and creams and all of that into those beverages. About 8 ounces per 15 pounds of body weight.
Dr. Oz has been heard to say, if you're not thirsty, don't drink. That's nonsense, that you should be drinking like 8 glasses of water a day.
Well, that's interesting.
I heard him say it, and it's like, what's coming from where?
Right.
What is the fact?
Right.
What's truth?
I'll have to do a little research on why he would promote that idea. Because again, I see only value in continuing to have fluid moving through the system, both your GI tract to help move materials through, and then through the kidneys to help, again, neutralize, detoxify.
I was very shocked when I heard him say that.
So again, I still will promote the idea of about, a cup of water per 15 pounds of body weight. So I'm around 150 pounds, so I should try and do 10 cups of water through the course of the day. I don't know if I reach that, but I'm always, sipping on something. So again, in a good judge, is your urine the color of straw? Or is it darker? Again, it should be pretty pale. Granted, some of your medications or vitamins will alter some of that coloring as well, but yes, indeed. Fruits and veggies, absolutely. 5 to 9 servings a day, and that's a tough one. Again, it is, and we really need to shift a lot of that toward the vegetables. Again, some fruit is good, but this is a sugar load, and sugars are inflammatory, so you want to really push more of those servings into the vegetable arena. Lots of color variety. You get that greatest nutrition from fresh. So if you're able to eat the fresh vegetables, please do it. Or at the very least, only saute lightly. Don't kill them. So you want to think they have the antioxidants and those phytonutrients in them that are going to help provide those building blocks for so many tissues and organs and functions. Think fresh fiber first, and certainly the greens. Again, we tend not to get that variety of lettuces and spinaches and kales and all of that. Test some of those during this next year of fresh gardens and such. Try to introduce them. Certainly minimize the use of refined grains, the white stuff, breads, crackers, cereals, cakes, all of that. Trans fats, so read the labels. High fructose corn syrup. Unfortunately, dairy products, and that's a tough one for me. I come from a farming family. But indeed, you really have to limit some of those dairy products. And a lot of it, unfortunately, is because of what we now know they use in raising cattle. some of the genetically modified elements and antibiotics and et cetera, growth hormones.
Doesn't that transfer into the meat also?
Exactly. So again, if at all possible, look for those organically sourced or at least locally grown resources where you know those resources better. Things like bologna, sausage, etc., those processed meats, they're tasty, but yeah, you don't want to eat a whole lot of that. Shop the perimeter of the store. Shop the outside edges. That's where your fresh produce, your fresh meats, etc. are. If you're spending a lot of time in those aisles, then you're buying a lot of the processed, refined, again, highly inflammatory products. Read those labels. Supplements. I get, lots of people ask, what kind of supplements should I take? Is there a good rule of thumb? And for me, these 4 are probably the ones I'm going to promote across the board to just about everyone. A good multiple vitamin. And I will say, I probably am inclined not to promote the one-a-days, those single tablets, things that you need to take maybe 3 or 4 and split them up for the day. I'd rather you do that because I'm just not convinced that a lot of those hard encapsulated tablets truly get digested well. So again, your choice, but definitely the situation where you get what you pay for in a sense. So be willing to. That I'd prefer that almost, that you can chew it up and help break it down from the get-go. That's going to be digested better. I mean, I even have, especially older folks, that I'll say, take a children's liquid because I know that's going to be digested better probably for them at that point in their life than, again, trying to take a tablet. Some kind of antioxidant, so that's vitamin E, vitamin A, add the C's to that, the antioxidants to reduce that oxygen degeneration that happens in tissue. Omega-3, so the fish oil products, really important for a lot of functions internally. And again, living where we do, we just don't have that source from our diet quite as readily. We're not inclined to eat salmon and halibut and cods as much. Again, the fish from the local waters is great, but it doesn't have the omega-3s in it. So look for that. And a probiotic, so a healthy bacterial component. So because for a lot of us also, because of what we happen to eat that has antibiotics in it, as well as what we end up taking because of illness and such, it does mess with our internal bacteria, that GI tract. And we have to have them there to help break down food effectively and help us absorb it. So again, a good and I should say antioxidant, especially vitamin D, right now I will promote, especially again, where we live. Again, it's involved in lots of processes as well. The omega-3s, probiotic. Choose to think well. I'd like to think the fact that you are here, you tend to be more the glasses half full kind of people too. That it's like, it really is kind of silly to dwell on negative connotations. So keep that, promote that idea of, I feel good, I'm doing okay. What can I do today to improve on that? Have that attitude of gratitude. Certainly intentionally reading some materials that help promote that idea instead of getting caught up in dark, exactly, negative type connotations. And certainly TV, we can really get sucked into the negative stuff too. So again, there's a major choice that people have to make is say, what do I choose to listen to read to expose myself to, see on the internet, etc. And unfortunately, it's more prevalent again to these young people than ever before. Move it or lose it. Absolutely huge. Daily movement is absolutely necessary for optimal health and wellness. A joint cannot be healthy if it can't move. So as a chiropractor, that's my goal, to help joints that are a bit stuck and immobile to move better. But that's true from, wrists and elbows down to knees and ankles. Despite having had injuries and issues, you do the best you can to keep the joint that has some mobility moving. And low-tech activities are absolutely as good as going to the gym and doing the circuit on these elaborate pieces of equipment. So again, just against your body weight, and hand weights are great, even the cans of soups. Motivation, of course, is the key. So finding some reason to get up and move always helps. We have a trip planned. I want to be able to hike this summer. I have grandchildren I want to keep up with, those kinds of motivational efforts. So the activity basics should include just a little daily stretching and fitness walking, so enough movement that it gets your heart rate up a little bit for, again, at least 5 to 10 minutes, more if you can. Again, you build up slowly though. The challenge always with new exercise programs is you feel pretty good the first day and kind of go gung-ho, and you're going to know it the next day. So you got to, again, work into that gradually so you don't end up straining muscles and such and causing a setback. So where does chiropractic fit into your health and wellness efforts? Perhaps you have a chiropractor as part of your health and wellness team. I'd like to think so, but indeed, I'd like to promote the idea our bodies are self-healing and self-regulating via the control of your nervous system. So as chiropractors, I work on the nervous system by reducing tension and stress on the nerves so they can do their job. So in turn, all of these internal organs, all of these muscles and joints can do their job. We live through our nervous system. Your nervous system has the storage capacity of 6 million Wall Street journals. That's a lot of information it's processing. It's responsible for coordinating and controlling the function of all tissues, all organs, all cells of the body. And any interference decreases the ability of the body to heal itself. So chiropractors remove nerve interference. People assume we're just there to crack that joint. You're going to get a crack. But it's not the joint, it's reducing tension, compression, irritation to the nerves, so everything works better. We must adapt to stress because we are surrounded by stress all the time. Some is good, some is not so good. So chemical stressors we can influence by having proper nutrition, good water intake, avoid drugs that are unnecessary, smoking, alcohol. I mean, those are some of the chemical stressors we're exposed to all the time. Physical stuff. Certainly people have had some birth traumas, just a tough delivery. That may be true for the mother as well. Posture, exercise, falls and injuries all fall into that category of physical stressors. Mental and emotional stressors, just our constant barrage of thoughts, the demands, our relationships with people, are those causing a lot of mental distress? And what can we do? What choices can we make to help ease those stresses, improve our lot? Chiropractic, again, helps our nervous system adapt to all those stressors to some degree. Again, by helping your nervous system function better, we can process those various stressors, adapt to them better. So where is your health compass? Is it directing you to true north, that optimal level? Ultimately, we all have the response ability to make good choices. We can respond to all of those proposed choices we are given every day. We have the ability to choose better. Sometimes it's tough, but make the effort. So again, thanks for joining me. More than happy to do this program for other organizations and such.
It's good to hear.
Yeah. Again.
You hear it's not like brand new and then you forget it.
Exactly. That's what I said. I think I probably did this maybe a year and a half ago. But again, it's good for me to hear it, especially after the hibernation period we just had. It's like,
are we out of it?
Maybe tomorrow, not today. It is back to wickedly cold. So again, thanks for coming and spread the word. Keep encouraging. Make those good choices. And well, again, it's typically a grass as a primary ingredient, some type of grass or seaweed, kelp, something like that is the base. But then they have, lots of various fruits and veggies that are ground up and dehydrated into this powder that you just add to water. Again, there's lots of brands. Exactly. Absolutely, at the health food center. I would guess that the grocery stores probably have one line of the product. We have them at our office, and again, we have access to lots of different ones. And probably the hardest part for people is finding one that the taste is okay to you. Again, I've tried probably a dozen different varieties over the years, and I always go back to, again, one line is called Greens First, and again, I happen to think, oh, I can drink this. It's okay. I choose to mix it with water. Some people will put it in juice to flavor it a bit, and often I'll put a little protein powder, which sweetens it a little bit as well. And again, drink my 8 ounces. And no.
Is it like having your vegetables today?
In a sense, it certainly gives you a couple servings worth of vegetables. Exactly. Should have had a V8 or a greens drink. Yes.
Something like that affect a person on blood thinners?
Because of the concern with eating greens when you're on blood thinners, potentially. You'd probably have to go at it gradually, smaller dosing, spread out through the day. But again, I think it's another option as opposed to taking a multiple vitamin, at least for those vitamins and minerals you're getting from.
Fish oil products too.
True. Again, depending on what medications you're on, and that's what drives me the craziest, unfortunately, that they can't, instead of giving you this medication, why can't you say, I want you to eat this, this, and this on a very regular basis? But that's maybe more difficult. No, not the same. Not the same. Okay.
Now you said to cut back on dairy, but is yogurt okay?
Yogurt's probably the better of the choices, absolutely, because it's always already a bit kind of pre-digested the way it's made. I would want you to watch, there's a pretty high sugar count in yogurt. And then when you go to the low calorie ones, then you're dealing with aspartame or other artificial sweeteners, which I don't like. So personally, I will mix plain with a little bit of flavoring or just throw in the fruit. And yeah, I don't buy flavored. Pardon?
What's the problem with aspartame? I see it listed on one of the yogurts, no aspartame.
Okay, and I'd say that's true for all synthetic sweeteners, that I absolutely will encourage people to eliminate that from their diet because it's a chemical. Your body doesn't necessarily know what to do with this, and it definitely has been tied to neurologic disorders and a lot of other health issues. Again, your body knows what sugar is. It knows what to do with it. We can't have it in excess, but I think there's more trouble with the artificial forms of sweeteners that, again, we put in our system and it says, what do I do with this? I'm not sure. I'm going to harbor it over here, and pretty soon it's creating irritation and inflammation and, yeah, distress.
Are you familiar with these new blood thinners that they're giving that they don't do the regular testing? There's 2 of them on the market that I see advertised on TV. They don't do monthly testing. I don't even know how
Oh, really?
they test, if at all.
Doesn't sound like they do.
No, it doesn't.
Wow.
And what about
Yeah.
using fish oils and greens when you're taking something like that?
Right.
That
And
would
it's,
scare me.
yeah, I haven't even heard. I don't think I've had a patient mention that they're on a new form of the blood thinners. I hear them often saying, I went in for my blood draw to check my
They've got
clotting.
ones out where you don't have a blood draw.
interesting. And again,
I don't know how they regulate it.
right.
I don't understand
right.
the workings of it.
And certainly that's not in my scope of practice at all. So I can't answer.
Find out if you're going to
Yes.
advocate fish oils and greens.
True. I have to know what my patients are on before I'm,
Is that, I don't even, do you remember the names of them?
No, I don't.
I don't
Okay.
either.
So it's a whole different spectrum. And
Yeah.
again, and I don't know if having a pharmacist here to talk about that is worth pursuing or not. But mostly I'm going to promote, let's help you avoid needing those. But again, the situation warrants it, so be it.
I'm always confused about talk of probiotics. Now, I see that Activia advertises there are probiotics. Is there enough in like a yogurt
Right.
thing to
Well, in the yogurt, it's really just maybe 1 or 2 strains of bacteria that help break down that milk protein and create a yogurt. So it definitely is a healthy form of bacteria that we want in our gut. But ideally, we have about 1,000 different strains of healthy bacteria. So that's where you can get it in, again, those powdered formulas, tableted forms, where it's going to have, yeah, millions of colonies in this tiny little tablet of a variety of, again, natural, healthy bacteria that help break down those food products so our body can then absorb them. And unfortunately, yeah, like
Probiotics then are the organisms that break down.
proteins in particular, but again, even the cellulose in fibrous foods, vegetables, et cetera, and you're going to also get them in things like fermented foods, the sauerkrauts and such. So if you like those foods, again, absolutely, kefirs, again, things that are naturally, you put this solution together to try and promote that breakdown. That's what we need as well, really, for a healthy gut. And unfortunately, some of the things we eat kind of deny that, again, from their processing and such, or we're just exposed to a lot of antibiotics inadvertently, let alone the ones we intentionally need to take for periods, and it just kind of creates a lot of havoc in that natural bacterial colony. And if that's wiped out, then makes room for lots of yeast. The yeast say, woohoo, we've gotten rid of the natural bacterial colonies, though we can take up housing, and that creates a whole other spectrum of problems. So again, I promote using a probiotic at least maybe once a week if you're feeling really pretty well. For those who are, again, dealing with a lot of antibiotic past issues, I do one every day for at least a stretch, couple, 3 months, and then you can start maybe weaning yourself and using, again, the food sources more regularly. Okay? Google searches, lots of Google searches, right?